My name is Maurice Cates, and I work for the Mid-Atlantic Permanente Medical Group. One of the most complex and involved procedures that we do in orthopedics are hip and knee replacements, shoulder replacements. And in our aging population, that is becoming more common. We were trying to find ways in Mid-Atlantic that we could make that procedure less anxiety-provoking and make it less complicated. And in Mid-Atlantic, we went down a path that very few healthcare organizations on the planet had gone down before, and that is doing these procedures in an ambulatory surgery center and sending patients home same day. When you think about that for a minute, most people will think about their parents or their grandparents who had hip replacement surgery, who spent 3 or 4 days in the hospital and 7 to 10 days in a rehab center before they went home. And in those situations, the complication rates were high. But home recovery, to be able to get up and walk hours after your surgery, to go home and recover in your own bed, have nurses come to you in your home. That is an experience that many patients value. Everybody has a central focus of doing what's best for the patient, with quality being the number one focus. And that is why I love working for Mid-Atlantic Permanente Medical Group.